Hi, my name is Lyle Murphy, the founder of the Alternative to Med Center, and today's video is going to be answering your frequently asked questions about Effexor. First question, what is Effexor used for? So they prescribed and allowed what they call on-label prescribing for Effexor is for major depressive disorder, generalized anxiety disorder, panic, and social anxiety disorder. Personally, even though I'm not a proponent of medication being a primary intervention, even for those who do subscribe to medications being the primary tools for psychiatric issues, I don't find Effexor to be a good drug for anxiety. I find Effexor to actually escalate people's anxiety, and people with an anxiety presentation, I would be really cautious about using Effexor for that. Next question, is Effexor bad for you? Well, I mean, drugs are bad, you know? I mean, they do things to your physiology that are forcing an effect that invariably is going to have ramifications, either downregulating to the drug or exhausting your serotonin or norepinephrine levels or causing a toxic burden that your body has to deal with, and yada, yada, yada. Now, does that outweigh the benefits? That is on a case-by-case basis, and that's a question for you to have to decide if your life's better or not with the medications. Oftentimes, the front-end effect of medications can be very impressive. A person has an alleviation of symptoms, they get back onto their life, and then they find a couple years later that they are in potentially even a worse situation than where they started. Next question, what are the long-term side effects of Effexor? Well, interestingly enough, there is quite a bit of controversy around, do antidepressants actually increase suicidality? So that has been established in the younger population, the 25 and under population, that a medication like Effexor actually increases the chance of them completing a suicide. But some studies have shown that the long-term effect can be up to a 15 times increase in suicidality, which if a person is taking the medication for suicidal type of ideations, I would think that could be a bit of a challenge to confront having that type of side effect being actually escalated. Since Effexor is typically perceived by most people as a stimulant, nervousness, anxiety, insomnia are very common with this medication. And for those choosing to be pregnant, this may be a medication that could complicate pregnancy, and you would want to ask your doctor about the possible maybe switching to a different medication that does not have that type of ramifications for the unborn. Next question, can I stop taking Effexor cold turkey? Rarely do I suggest stopping a medication cold turkey, unless, of course, the person is having very dramatic reaction to the medication and your doctor's decided that's the best thing to do. It's kind of like asking me, should I step off the building of, where I work? It's a 4-story building. Should I just step off the edge of the building or should I take the stairs? In most cases, I would say take the stairs. Even though it takes you longer to get down to where you want to be, at least you can get there intact and not have a completely wrecked nervous system. Some people can get away with taking away a medication and not have complications. For those people who think that they're more hardy than most, maybe doing a 25% cut and seeing how you do with that for a couple of weeks. If that went well, maybe do another 25% cut and see how that goes. And when you get down below the 50% mark, maybe do smaller cuts, especially the last 25%. I wouldn't suggest taking the last 25% of the medication away in one swoop. Maybe breaking that up into 2 different drops would be the way to go for the more hardy people. For people who are already sensitive, the the turtles win a lot of races, because they go slow. And trying to drive a logging truck down an icy mountain takes skill and precision, and that's what this can be like. You don't want to go at it too fast, or you end up flipping off the curve, and it's a catastrophe. So generally, the rule is to do it at a pace that you can handle, and to be calculated in the way you go about it, and know that whatever's coming up within the first few days or week after dropping the medication is probably a withdrawal reaction from the medication, and not other people around you or life situations quite as much. Those things tend to get amplified when you're going through a medication withdrawal such as this. Next question, how long does it take for Effexor to get out of your system? Well, Effexor is, besides maybe Luvox, is the shortest acting antidepressant of them all. So people can go into withdrawal after 5 hours of taking this medication, but certainly within 1 day, if they're going to have withdrawal reactions, they're probably feeling them already within 1 day. So that is a complication in some ways, because the medication cuts are going to be felt very quickly. And there's another saying, it's not the speed that kills you, it's a sudden stop. This one has a sudden stop built into the pharmacodynamics of the medication, in that you go into withdrawal and it hits hard. So unlike Prozac has a half-life of 5 days. It's got a natural taper built into it. Sometimes people can stop Prozac and hardly even notice it because it leaves the system so slowly. Effexor, people usually feel it pretty hard and fast, and of course they're more inclined to continue their medication because it scares them. So sometimes people have to go about this medication reduction in a very slow way compared to other antidepressants. Next question, how do I wean off Effexor? Well, we covered that. You do it somewhat slow. A pragmatic approach for the more sensitive might be a 10 or even a 5% entry cut. See how you do with that. And you may have to wait a week. Some people might even have to wait 2 weeks for the withdrawals to sort of abate. Now, there are people who those withdrawal manifestations do not abate. They seem to go into this protracted withdrawal situation. So there is a couple hacks for this. Everyone's different. Some people may like these hacks. Some people, it may not work for. But one of them is, Effexor is a two-pronged drug. So it, in theory, raises serotonin and also raises norepinephrine. Norepinephrine and serotonin are very different neurochemicals. One is an inhibitor and inhibits impulsive sort of behavior and helps you sleep and keeps you from ruminating about things and lessens your anxiety. And the other one does somewhat the opposite. It raises your ability to be attentive. It raises your wakefulness, possibly into nervousness and anxiety. So when you're dropping both of these medications at the same time, if you go into a serotonin plunge, you may have crying jags, you may have brain zaps, you may have inability to sleep, you may have an escalation of your anxiety because you're going through a serotonin drop. But you're also going through a norepinephrine drop as well. So you should kind of break up like the double fall at the same time. Sometimes what people do, and sometimes what we do when people are stuck, is we will use a modest dose of Prozac, bring that in at the same time we're reducing down the Effexor. So they go through the norepinephrine drop, get off the Effexor, and now they're on a drug with a longer half-life that's a lot easier to get off of. That's one way to stair-step off of this. Another thing that we use is we use the precursors to making particularly serotonin, because it's usually the serotonin plunge rather than the norepinephrine plunge that people experience the hardest withdrawal from. So bolstering the fall from the serotonin usually is the way to to really alleviate a lot of what people are going through. And so what that looks like is using tryptophan or 5-HTP during the withdrawal. Now, I want to preface this by saying the inclusion of tryptophan or 5-HTP is only intended for the purposes of withdrawal. If you do if you do a precursor, a serotonin precursor like tryptophan or 5-HTP in addition with an antidepressant long term, you could develop a even fatal disposition called serotonin syndrome. I have never personally seen anyone with serotonin syndrome, but it is out there in the literature, and pharmacologically it is possible because you're flooding the body with the precursors for serotonin. At the same time, you're reuptaking all of it. So you could build up a level of serotonin that could have challenges. So you're bringing in one while you're taking away the other. So you're reducing or eliminating that possibility. Now, I can't tell you, obviously, not being your practitioner, or give medical advice in any way on how you should go about doing that or reducing your medications. This is something you need to talk about with a trusted provider. If you do not have a trusted provider, if you don't think that your provider has the skill set to be able to help you here, I would strongly suggest that you find someone who does. Now, depending on where you are in the country, that could be easy or that could be almost unreasonable. One database you can go to is the acam.org. If you go on there, there's a link for Find a Practitioner, and you put in your zip code. You don't really have to put in your address, just zip code and the range that you're willing to travel. I usually set the radius for 100 miles. And then when I get a population of people, hopefully you do get some returns, I scan through those practitioners for someone who is an integrative psychiatrist. Sometimes you can look at their URL for their website and it says ... psychiatry. So those are going to be doctors who have a reasonable amount of ability to navigate these sorts of things. Another database is called the IMMH.org. Has a similar principles. Set the radius, put your zip code in, and then scan the practitioners for ones that seem like they have some know-how in psychiatry, and then bring up to them that you want to try to use tryptophan to help you get, or 5-HTP to help you get off this medication. One way that we have done it here is we start the tryptophan and 5-HTP, oral or IV, 2 weeks prior to doing the withdrawal, and then that gives a person enough serotonin levels to not go in a serotonin plunge when they're coming off of a serotonin reuptake inhibitor like Effexor or Paxil or Zoloft, doing it at home without guidance. Again, I've never actually seen serotonin syndrome, but I would hate to give this kind of advice to someone and then have someone have that happen to them. Personally, for me, if it were me, I would feel comfortable doing it on me or my family or, patients, but I have a bit of know-how around how to do that. And that gives me a certain advantage. But still, I would think, and I can't state this for you. You have to determine your own safety level. But I would think that the benefits of using the tryptophan at the same time you're coming off of it would be good. That is the end of our questions on Effexor today. I really do appreciate you joining me. There are other resources on the website that if you happen to be on our website rather than YouTube, there's an article on there called Antidepressant Alternatives. You can look in the search bar on the website and type in antidepressant alternatives and find that page. There's another one called antidepressant tapering that can help you with some further information that you might need in order to be able to understand this a bit better. Thank you and have a good day or night.